Understanding heat stroke, a silent summer threat. Heat stroke is a serious medical emergency. It happens when your body gets too hot. It's important to know how to prevent and treat heat stroke. Imagine your body like a car engine. When a car overheats, it stops working. That's similar to what happens during heat stroke. Your body's cooling system fails and your internal temperature rises rapidly. This can damage your brain and other vital organs. Heat stroke is dangerous. It can even be fatal if not treated quickly. Causes of heat stroke when your body overheats. Heat stroke usually happens during hot, humid weather. Your body can't cool down properly when it's too hot outside. Strenuous activity in the heat is a major cause. Think about athletes training in hot weather, or construction workers outdoors in the summer. Certain medications and health conditions can make you more susceptible. These include heart disease, diabetes, and obesity. Dehydration is a big risk factor. When you don't drink enough fluids, your body can't cool itself efficiently. Recognizing the signs. Is it heat stroke? Knowing the signs of heat stroke can save a life. It's not just feeling hot, it's much more serious. One of the first signs is confusion or disorientation. The person might seem confused or not know where they are. High body temperature is a key symptom. This is usually above 104 degrees Fahrenheit. Other signs include rapid heartbeat, rapid breathing, and headache. The person might also have nausea or vomiting. If you see these signs, call 911 right away. Heat stroke is a medical emergency. Immediate action is essential when dealing with heat stroke. Knowing the right first aid steps can make a significant difference. Every second counts when someone is suffering from heat stroke. The faster you act, the better the chances of preventing serious complications. Quick action is crucial until medical help arrives. Your prompt response can stabilize the person and prevent further harm. First, move the person to a cool place. This could be indoors, under a tree or any shaded area. Get them out of the sun and into the shade or an air-conditioned building. The goal is to lower their body temperature as quickly as possible. Next, try to cool them down quickly. Remove any unnecessary clothing to help their body release heat. Fan them, and apply cool water to their skin. You can use a sponge, cloth, or even a spray bottle to moisten their skin. Giving them cool water to sip if they're able to drink can help too. Small sips are best to avoid overwhelming their system, but never force someone to drink if they're having trouble swallowing. This could lead to choking or other complications. Remember, these steps are just first aid. They are meant to stabilize the person until professional help can take over. It's vital to get professional medical help as soon as possible. Call emergency services immediately and follow their instructions while you wait. Emergency responders are trained to handle heat stroke and can provide the necessary medical treatment to ensure the best outcome. With prompt and effective first aid, followed by professional medical care, the chances of a full recovery from heat stroke are greatly improved. Section 5. Cooling down effective methods to reduce body temperature. Cooling the body down quickly is essential in treating heat stroke. Heat stroke is a serious condition that can lead to severe complications if not addressed promptly. Here are some effective methods. First, cool water immersion. This method involves immersing the person in a cool bath or shower, which is one of the most effective ways to lower body temperature rapidly. Immersing the person in a cool bath or shower is very effective. The cool water helps to bring down the core body temperature quickly, which is crucial in preventing further damage. It helps to lower body temperature rapidly. Another method is the wet sheet technique. Next, the wet sheet method. This involves wrapping the person in a cool wet sheet and fanning them to enhance the cooling effect. Wrap the person in a cool wet sheet and fan them. The combination of the wet sheet and fanning helps to cool the skin through evaporation. The evaporation helps to cool the skin. Then, ice packs. Ice packs can be very effective in cooling down the body. Apply ice packs to the groin, armpits, and neck. These areas are ideal because they have large blood vessels close to the skin, which helps to cool the blood as it circulates. These areas have large blood vessels close to the skin. Lastly, evaporation cooling techniques. This method involves spraying the person with cool water and fanning them to enhance the cooling effect. Spraying the person with cool water and fanning them helps with evaporation and cooling. This method is particularly useful when other cooling methods are not available. Remember to monitor their temperature and continue cooling measures until medical help arrives. It's important to keep a close eye on their condition and ensure that their body temperature is steadily decreasing. Section 6. Long-term management. Recovering from heat stroke. Recovering from heat stroke can take time. The severity of the heat stroke determines the length of recovery. Rest is crucial. Your body needs time to heal and recuperate after such a stressful event. Staying hydrated is essential. Drink plenty of fluids, especially water, to replenish your body's fluids. Avoid strenuous activity and heat exposure during recovery. Your body needs time to regain its ability to regulate temperature. Follow your doctor's advice and attend any follow-up appointments. They will monitor your progress and make recommendations for your recovery. Section 7. Preventing heat stroke. Staying safe in the heat. As temperatures rise, it's crucial to be aware of the dangers of heat stroke and take steps to protect yourself and your loved ones. Prevention is always better than cure, especially with heat stroke. This condition can be life-threatening, but with the right precautions, it can be avoided. By taking some precautions, you can significantly reduce your risk. Simple actions can make a big difference in staying safe. Stay hydrated by drinking plenty of water throughout the day, especially during hot weather or exercise. Dehydration is a major risk factor for heat stroke. Avoid strenuous activity during the hottest parts of the day. The midday sun can be particularly intense, making it easier to overheat. If you must be outside, take frequent breaks in the shade. This helps your body cool down and prevents overheating. Wear loose-fitting, light-colored clothing to help your body stay cool. Dark colors absorb more heat, making you feel hotter. Hats and sunglasses provide additional protection. They shield your face and eyes from the sun's harmful rays. Never leave children or pets unattended in a parked car, even for a few minutes. The inside of a car can become dangerously hot very quickly. The temperature inside a car can rise rapidly, reaching levels that can cause heat stroke or even death. Always check the back seat before locking your car. Use fans and air conditioning to stay cool indoors. Keeping your living space cool is essential during heat waves. Check on elderly neighbors and family members. They are more vulnerable to heat-related illnesses and may need extra assistance. Recognize the signs of heat stroke, such as dizziness, confusion, and a rapid pulse. If you or someone else shows these symptoms, seek medical help immediately. By following these tips, you can enjoy the summer safely and avoid the dangers of heat stroke. Stay cool, stay safe, and make the most of the sunny days. Section 8. Special considerations. Children and seniors. Children and seniors are more vulnerable to heat stroke. They may not be able to regulate their body temperature as effectively. Keep a close eye on children playing outside in the heat. Make sure they take frequent breaks and drink plenty of fluids. For seniors, it's important to stay cool and hydrated, especially if they have underlying health conditions. Check on them regularly during hot weather. Adjust activities and time spent outdoors based on the heat index, not just the temperature. Section 9. Key takeaways: protecting yourself and others. Heat stroke is a serious medical condition, but it's often preventable. Remember these key takeaways to stay safe. Recognize the signs: high body temperature, confusion, rapid heartbeat. Act fast. Call 911 and start cooling the person down immediately. Prevention is key. Stay hydrated, avoid strenuous activity in the heat, and wear appropriate clothing. Special care for vulnerable groups, children and seniors need extra attention during hot weather. By being aware of the dangers of heat stroke and taking necessary precautions, you can protect yourself and those around you.